Make sure you check out this video. I'm going to share my biggest concern with you about bunions and bunions treatments and some of the myths and concerns that I see all the time after successfully treating bunions for 20 years without the need for surgical intervention. My name's Daniel Fitzpatrick from Sydney Foot Solutions. We see at least 100 bunions a week through our clinic. We see lots and lots of bunions and have done for well over 20 years. And we have significant expertise in this field. So it's not that surgery is bad, and I'm not here to bag surgery, but the reality is that there are other options you can consider if you want to avoid the need for surgical intervention. And in fact, surgical intervention should be only considered in extreme cases. The concern I have is that people often think that their only option is surgery. The great news is you can usually avoid the need for surgery if you get onto your bunions sooner rather than later. Even if it is quite advanced, there's still quite a lot we can do to help without the need for surgical intervention. And the benefit of that is that there's no recovery time. You can keep active throughout the process. You can stay on your feet. Not to mention the costs associated with surgery are hugely significant compared to us. In fact, they're probably 10 times what we are. And if you Google the cost of surgery, most surgeons now are charging anywhere between $6,000 and $9,000 per bunion. Our costs are nowhere near that, thankfully, depending on what your needs are. And in fact, if you are concerned about your bunion and want to get it checked out quite cheaply, we have a 60% off initial bunion assessment. I would strongly advise you to check that out. You can come in and get professional advice in regards to your bunion for just $40, which I think is a pretty good start. And the reason we offer that is we really want to help as many people with bunions. Now, another big myth that I see is that people don't realize what a negative effect tight runners can have on their bunions. So when you're fitting your shoes, if you have tight runners, they can significantly increase the pain, increase the development of the bunion, and drastically affect the long-term outcome. So make sure that you buy your shoes bigger rather than smaller. And the reason I bring this up is that this comes up all the time in our clinics, and people are pretty disturbed. The other thing is, if your shoes are a bit tight, take the inner sole out. Just take that out. It usually makes a big difference, and try not to wear any shoes that are too tight. Just for the record, it doesn't matter to me. I find I don't have to restrict patients if they do want to wear high heels or more feminine footwear. Ideally, you would get them wider, but the reality is that our treatments can assist you in wearing a wider variety of footwear. So we're not here to get rid of all your nice shoes. It's just that we would encourage you to get bigger shoes. What I would say as well is that if you do have a pair of boots that you love, just get them stretched. Take them to a good boot maker. I know we've got one near us that we use all the time, and we just get them stretched out through that area. So there's a great deal you can actually do, and there's a great deal that we can help you with. So another thing that we often see is that people don't realize why they actually get a bunion. And so the reason that people get a bunion is because of the way you stand and the way you walk. People say to me all the time, oh, but my bunion's genetic. And yes, it is absolutely genetic. But what you inherit is you inherit a level of misalignment associated with your bones. And that causes compensation in the way you stand, the way you walk. The reason I take that time to explain that is that if we get that right and we start to correct that back into a better position, we can actually create a really positive long-term effect on your bunion, and we can help that dramatically. So just keep that in mind and make sure you try and get on top of that sooner rather than later. Try and get professional advice as soon as you possibly can, particularly if you would like to avoid bunion surgery. And keep in mind that we see lots and lots of bunions, and your only option isn't the need for surgical intervention. I find that's just such a significant common misconception. So I would try and get onto that sooner rather than later. Make sure you check out our website at sydneyfootsolutions.com.au, and we're offering a 60% off initial bunion assessment.